You take your blood pressure pill every single morning. You do what your doctor told you. And still seeing 145/90 on that cuff. That's one of the most common and most frustrating situations I hear about. And honestly, it's more common than most people realize. The medication isn't necessarily failing. Something else is getting in the way. And once you understand what that is, you can actually do something about it. First, let's talk about how blood pressure medication works, because this matters. Most people are taking one of a few types of pills. AC inhibitors like lisinopril and ARBs such as losartan, they both work by relaxing your blood vessels by blocking a hormone system called the renin-angiotensin system. Beta blockers, including metoprolol, slow your heart rate and reduce the force of each beat. Calcium channel blockers like amlodipine relax the smooth muscle in the walls of your arteries. And diuretics, often called water pills, help lower your blood pressure by reducing excess fluid in the bloodstream. Each type targets one specific part of the problem. That's the key word, one part. Your blood pressure is controlled by a whole system working together. Your heart, your kidneys, your hormones, your blood vessels, your nervous system. If your medication is fixing one piece but something else is pushing in the wrong direction, the numbers won't come down the way they should. That's what we need to look at. Salt is probably the biggest hidden reason blood pressure stays high on medication. And most people have no idea how much they're actually getting. It's not about how salty your food tastes. It's about what's hiding inside everyday foods. Canned soup, deli meat, bread, cheese, fast food sauces, frozen meals. These foods carry huge amounts of sodium even when they don't taste particularly salty. Here's what sodium does in your body. Your kidneys use salt to decide how much water to keep in your bloodstream. More sodium means more water stays in. More water means more pressure inside your blood vessels. That's exactly what you're trying to bring down. Some blood pressure medications work by helping your kidneys flush that extra salt and water out. But if you're eating 3,000 or 4,000 milligrams of sodium a day, the medication is fighting a losing battle. It's like trying to bail water out of a boat while someone keeps pouring more water in. For most people with high blood pressure, the goal is under 1,500 milligrams per day. The average American eats more than twice that amount. Cutting sodium alone, without changing anything else, can lower blood pressure meaningfully in many people. Sleep affects your blood pressure more than most people expect. When you sleep, your blood pressure is supposed to naturally drop. Your body uses that time to rest and recover, but if your sleep is poor, either from not sleeping enough or from interrupted sleep, that drop doesn't happen the way it should. There's a condition called sleep apnea that plays a major role here. With sleep apnea, your airway partially closes while you're asleep. Your breathing stops briefly, sometimes dozens or even hundreds of times each night. Every time it happens, your brain senses the drop in oxygen and sends an alarm signal. Your heart speeds up. Stress hormones spike. Your blood pressure jumps. This happens over and over through the night, and those repeated surges carry into your daytime readings. For people with untreated sleep apnea, blood pressure medication often makes very little difference. Treating the sleep apnea, usually with a device called a CPAP that keeps your airway open, can lower blood pressure as much as some medications do. Signs to watch for: loud snoring, waking up tired even after a full night's sleep, or a partner who notices you stop breathing in your sleep. If any of those apply to you, ask your doctor about a sleep study. It could explain a lot. Your adrenal glands are small glands that sit on top of your kidneys. Most people only think about them when talking about stress. But they also make a hormone called aldosterone, which tells your kidneys how much salt and water to keep in your body. In some people, one of these glands starts making too much aldosterone. When that happens, your kidneys hold on to far more salt and water than they should. Your blood pressure goes up and stays up, no matter how many medications you take. This condition is called primary aldosteronism. It's more common than most doctors once believed. Studies suggest it might be behind roughly 1 in 10 cases of high blood pressure, and many of those cases are never caught. It doesn't always cause obvious symptoms, but a simple blood test can check for it. If your blood pressure has been hard to control even with multiple medications, it's a reasonable question to ask your doctor. Could we check my aldosterone levels? In some cases, the cause turns out to be a small growth on the adrenal gland. Removing it can bring blood pressure down dramatically, sometimes without medication at all. Some of the things you take for completely unrelated reasons can push your blood pressure up without you realizing it. The most common example is ibuprofen and naproxen, the pain relievers most people have in their medicine cabinet. These drugs cause your kidneys to hold on to extra fluid. They also reduce the effectiveness of several blood pressure medications. If you're taking them a few times a week for back pain, knee pain, or headaches, that pattern alone could be keeping your numbers elevated. Decongestants are another one. Products that clear a stuffy nose, especially those containing pseudoephedrine, work by narrowing blood vessels. That's what reduces congestion. But it also raises blood pressure at the same time. Other things to be aware of: certain antidepressants, stimulant medications used for ADHD, some birth control pills, and certain herbal supplements including licorice root. If your readings got worse after starting something new, that connection is worth bringing up with your doctor. Exercise has a real, measurable effect on blood pressure, separate from weight loss. Even if your weight doesn't change at all, regular aerobic exercise makes your blood vessels more flexible and reduces the background activity of your stress response system. Over time, that brings resting blood pressure down. The size of that effect is significant. Regular moderate exercise, walking briskly, rucking, biking, swimming, can lower the top number of your blood pressure by 5 to 10 points in many people. That's similar to what some medications do at standard doses. But the word regular matters a lot here. An occasional walk doesn't produce that result. Your heart and blood vessels need consistent activity to adapt. Aim for 3 to 5 sessions per week, around 30 to 45 minutes each, at a pace that gets your heart rate up but still lets you carry a conversation. If you also need to lose weight, that adds to the benefit. Losing 10 pounds typically drops blood pressure by 3 to 5 points. That might not sound like much on its own, but combined with the right medication, lower sodium, and better sleep, it adds up quickly. Ongoing stress keeps your body in a state of low-level alarm. Your nervous system stays active when it should be calm. Stress hormones like cortisol and adrenaline stay slightly elevated. Your blood vessels stay a little constricted. Your heart rate sits a little higher than it should. Over time, that constant tension adds up in your blood pressure readings. This doesn't mean stress is the only issue, or even the main one. But if you're dealing with significant, ongoing stress from work, money, relationships, or other sources, your body is paying a physiological price that shows up on that cuff. Slow, deep breathing, the kind where your belly rises and falls, activates the part of your nervous system that calms things down. Regular physical activity reduces cortisol over time. Getting enough sleep helps regulate your stress response. None of these are quick fixes, but they each move real numbers in the right direction. One more thing worth being honest about, and this isn't about blame. Missing doses of blood pressure medication is extremely common. Unlike a painkiller, where you immediately feel a difference when you take it, blood pressure medication has no obvious effect you can feel. You don't feel better when you take it. You don't feel immediately worse if you skip it. That makes it easy to forget, especially if the medication causes side effects like fatigue or dizziness. But blood pressure pills need to be in your system consistently to do their job. If you're missing doses several times a week, the drug never builds up to a stable working level. Your blood pressure goes up and down with your dosing schedule instead of staying controlled. If side effects are making it hard to stay consistent, that's an important conversation to have with your doctor. There may be a different medication or a different dose that works better for you. There's also evidence that taking at least one blood pressure medication in the evening, rather than the morning, can improve overnight control for some people. It depends on your personal pattern, but it's worth discussing. If your blood pressure is still high on medication, the answer usually isn't just adding another pill. The answer is figuring out which piece is missing: sodium, sleep, hidden hormonal problems, other medications you're taking, lack of physical activity, ongoing stress, inconsistent dosing. Any one of these can keep your numbers elevated despite doing everything else right. Most of them can be identified. Most of them can be fixed. Ask your doctor about wearing a 24-hour blood pressure monitor. It takes readings automatically throughout the day and night and gives a much clearer picture than a single reading in the office. It can reveal patterns, like blood pressure that stays high during sleep, that completely change how the problem gets treated. You're not stuck with these numbers. Knowing why they're high is the most important first step toward actually getting them down. And there you have it. Take this knowledge and take control of your health. Thank you for watching.